Good afternoon and welcome. Thank you for joining us today. My name is Samantha, and I'm the Director of Member and Partner Services for the Florida Association of ACOs. We are excited for this opportunity to present to you our next installment of our webinar series, Enhanced Care Collaboration with Your SNF Partners. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You will see a user control panel on your computer desktop. You can listen in via your computer speakers, or if you would prefer to join over the phone, just select the arrow up on the mute button and choose to switch to phone audio, and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenter by typing your questions into the Questions tab. You may send in your questions at any time during this presentation. We will answer them during the Q&A session at the end of today's presentation, or you can raise your hand and we will unmute you to ask your question directly to our presenter. With that, I'm going to turn the presentation over to our presenter, Jose.
Hi, thanks for that, Sam, and thanks for FLAACOs for having us present today. My name is Jose Galanado. I am a state director at PointClickCare, and I will be today's host. I'm a registered nurse by background, having worked in various clinical and operations leadership roles in the past, both on the acute care setting and at the top health setting as well. Most recently, managing and directing the orthopedic services at University of Colorado prior to joining PointClickCare. Today, I'm excited to be joining you to talk really about how different ACOs and different risk-bearing entities are developing their strategies around coordinating and collaborating with post-acute care organizations and facilities. As you know, and for a lot of folks here on in the ACO space, you may be making headwinds in terms of decreasing the cost of care for your membership by reducing ED visits or inpatient visits. And we're now seeing a lot more folks focusing on that next level of further improving care coordination and transitions of care and lowering costs by partnering and collaborating with their skilled nursing facility and post-acute care partners. So today, that's what we'll be talking about. We'll be talking about how skilled nursing facilities have become a key stakeholder for a lot of ACOs. We'll talk about what we've been seeing in the market in terms of different ACOs approach to post-acute care collaboration. And then we brought a guest in today, and I'll introduce her later, to talk about how they're developing those strategies and putting those strategies in action, and the role of data that plays into those strategies. And then finally, we'll look into how we're able to present you with a lot of the data that you're needing to develop and execute on a lot of those strategies. So in terms of who we are, PointClickCare, we've been known as the largest EHR provider for the senior care and post-acute care space over the last few years. And so much so that over time, a lot of organizations and ACOs have been coming to us and asking us to share data for a lot about their membership during that skilled nursing facility stays. At the same time, skilled nursing facilities and senior living facilities are coming to us and saying, hey, we're having to share a lot of data to a lot of different entities under value-based care arrangements. And it is pretty burdensome administratively to share that data either by fax, managing different Excel spreadsheets. So they've come to us and asked, hey, as our EHR vendor, is there a better way to share that data? And so over time, we've built our network, not just on the skilled nursing side and the senior living side, but also across this network of the care continuum in such a way that we're able to connect data that across the care continuum for organizations like yourselves who are managing their members and different patients and residents across the care continuum. And so, did I hear? I thought I heard someone go off mute. Uh, but moving forward, and we've been getting a lot of more of these requests. As you see here, 60 billion of Medicare spending has been spent on post-acute care, which is about 15% of that Medicare spending. Highest of these expenditures in the post-acute care space are on skilled nursing facilities. And even though we've been seeing a decreased usage of skilled nursing facilities, uh, particularly during the pandemic, the spending has also decreased during the pandemic to 2 billion from a 2.1. That really shows the commitment of a lot of different organizations to really decrease that spending during that member's skilled nursing facility stay. And so some of the strategies that we've seen different skilled nursing facility or different ACOs do in terms of managing the cost and increasing the quality of their membership during that SNF stay is one, forming a preferred skilled nursing facility network based on certain criteria. That criteria can just be based on geography, based on access, but sometimes different ACOs form a preferred skilled nursing facility network based on key outcomes as well. For those ACOs that are also are part of a clinically integrated network that encompasses hospitals as well, they also have in-hospital strategies wherein they look at discharge planning, performing perhaps a verbal SNF handoff from the inpatient stay to the skilled nursing facility stay, or having a SNF liaison that acts as a conduit between this the acute care facility and the skilled nursing facilities. Over time, as a lot of different ACOs refine their strategies, we're seeing more and more in-SNF strategies, as I would call it, where they would have embedded ACO or physician practice embedded staff in the skilled nursing facilities, where whether it's a physician extender, a social worker, an additional discharger, or a pharmacist. This allows for a lot of ACOs to really have a tighter control in terms of the quality of care that the patients and the members are getting at the skilled nursing facilities, and some create treatment protocols or discharge processes for their specific members at those skilled nursing facilities. And finally, we're also seeing more and more ACOs having quality incentive programs wherein they do contract with different skilled nursing facilities to do some financial, whether it's within a shared savings or within just a flat incentive for meeting certain quality measures of length of stay or readmission for their members within those specific skilled nursing facilities. Now, a lot of times when ACOs and different risk-bearing entities look at their strategies, one of the biggest barriers that they see is the lack of visibility of data from those skilled nursing facilities. And that's become a huge barrier that we are hoping to partner with different ACOs to overcome those barriers and find solutions to make those strategies more feasible, and that collaboration and communication with skilled nursing facilities a bit less cumbersome. Luckily, in Florida, we have a huge market presence wherein about 80% of skilled nursing facilities use PointClickCare, and that means that we have a large footprint and have real-time data for a huge portion, if not all, of your members that are staying at those skilled nursing facilities using our EHR. That 80% accounts for 600 plus facilities in the state of Florida. But do note that if your organizations see members, have members that go to skilled nursing facilities or may reside outside of the state. So think about within here in the borders and the panhandle. We also have a huge market share, not just in Florida, but across the state, that then we would be able to give you visibility of what's happening with the patients during those and your members during the SNF stay. Do keep in mind that a lot of you all probably already are getting alerts and notifications for when your members are admitted or discharged from a skilled nursing facility. PointClickCare is able to then complement that and augment that by giving you visibility for what's happening with your members during that SNF stay, so that you can prevent any adverse outcomes from happening, such as any hospital readmissions or trips to the ED, and prevent any excess length of stay for your members at those skilled nursing facilities. And so what does that mean that we're able to give you visibility of data from the skilled nursing facilities using PointClickCare? That means that in real time, without having to wait for any claims data, we would be able to show you a network scorecard. And this gives you a real-time performance metrics for your post-acute care network specifically for your patient population. So not just for all of the patients or residents that have been at those skilled nursing facilities, but really just specific for your patient population, giving you a more lead metrics of how you may be doing in terms of readmissions and length of stay without having to wait for claims data. Our network scorecard within our solutions also allow you to hone in on specific types of patient populations within your membership to dig deeper into problem solving to see where your outliers may be and where you can make the most impact in terms of your interventions. What's more is that we're also able to give you live patient data as they're occurring at the skilled nursing facility. So not only are we able to show you who among your members are having an active stay at a skilled nursing facility, but give you a clinical view of how they're doing without having to pick up the phone to call the skilled nursing facility and ask how Mr. Jones is doing at the skilled nursing facility and how close they are from being discharged. But really, this allows you to have that view right from the EHR of the skilled nursing facility. It's a win-win too for the skilled nursing facilities, because then it's less of an administrative burden for them to collaborate and communicate with you all. And so with that, I want to really, I say talk is cheap. So we've invited Andrea, one of our key partners in the state of Florida, to really talk more about how this works in real life and kind of hear more about what strategies other folks within your market are doing in terms of collaboration with their skilled nursing facilities and sharing data and what interventions they're taking. So welcome, Andrea. Are you off mute now?
I am off mute. Thanks, Jose.
Hi, welcome. Thanks for joining us today. Yeah, would you be able to tell us and the audience real quick about yourself and your organization to provide a bit more of a context?
Sure. So my name is Andrea Coffin. I am currently with Better Health Group, and I'll talk about that in just a minute. I have actually worked in the healthcare space for over 30 years. I started out as a clinic administrator for many years in North Carolina, and then moved to Florida and was an educator in several of the nursing colleges and allied health and nursing colleges in the Orlando region. So then I moved into value-based care, and value-based care has become a passion of mine. I started with Better Health Group in the Medicare Advantage space and then moved into the Accountable Care Organization. We started with MSSP back in 2018, and we have now 5 MSSP ACOs. We have 1 REACH and a commercial ACO with Blue Cross Blue Shield. So Better Health Group, let's talk about Better Health Group. So we have been in the industry for about 20 years. We work with independently owned primary care providers, and we serve patients, as I said, across Medicare through MSSP and REACH, through Medicare Advantage. We have a Medicaid platform. We also, as I said, have Blue Cross Blue Shield commercial ACO, and we work across 10 different states. So all of our products are, of course, in the value-based care space, and we primarily focus on seniors. However, we do have some pediatrics in our Medicaid line of business.
Great. Thanks for that context, Andrea. So tell us a bit more about your journey in terms of developing post-acute care strategies and tactics to improve the quality of care for your members, and as well as reducing that cost for your members during their SNF stay.
Sure. So obviously we started out with, let's start with transition care management and transitioning these patients into the right discharge setting from their inpatient stays. And then from there, we were able to bring on a more robust program. And we do use the platform through PointClickCare, and we use, well, we call it the Pac-Man platform. So post-acute care management. So for that, we're able to really help manage those patients while they're in that SNF setting. We use a group of registered nurses led by our medical director, Dr. Haas, and really following those patients. As soon as we find out they're about to be discharged, we start managing where do they need to be, what SNF do they need to go to. If they end up in a SNF that we didn't have a say in, that's okay too. We go into the tool. We manage those through really following their patient status. There's a patient status on the portal. I don't know if you're going to show the portal today, but
I will be. Yep.
The portal does show, they have a rising risk of readmission, different things. So following that, checking that status every morning to see what has changed, what has risen in risk, checking their vitals, being able to really look at their labs, their radiology. So being able to get a better picture of that patient and then coordinate with the SNFist, coordinate with the nurses that are on the ground in the SNF and seeing that patient regularly. So that has really become a very robust program for us. We follow every patient that is discharged to a SNF through this platform.
Great. So for an ACO, for instance, that's looking to develop, or who may be new in creating their post-acute care strategy, they may be asking, well, how much resources do I dedicate for this program to use a tool or to follow patients? What does your team composition and structure look like, and how are they using the data from the SNFs to manage transitions of care? So
we have each nurse manager manages approximately, I'm trying to remember what our ratios are. I have too many ratios in my brain right now. I may have to get back to you with that in a minute, but we do have a team of about 8 RNs that manage our SNF population, keeping in mind we are across 10 states, so those are not all exclusively Florida. But in Florida is our largest patient population in all of our lines of business. So with that being said, we really tackled it from a Florida up standpoint. So which states do we see the most SNF coverage? And of course, Florida has a really good SNF coverage on this tool. So a lot of SNFs are participating and documenting in there. So that allowed us to really be more aggressive with our patient management. How do we look at their vitals each day? What kind of changes are we looking at? So for example, let's say we have a COPD patient. I'm looking for changes in their O2 saturation. I'm looking at changes in their respiratory rate, anything to indicate, hey, they may have a possible pneumonia starting. Then I'm able to coordinate with the SNFist that's there. If the SNFist is not there, because of course some of them are only there a few days a week, we're able to coordinate with the nurses that are there, put in lab orders. We're able to have some input on, hey, we'd like to have this patient have a chest x-ray. We'd like to have this patient have these lab orders. We want to see what happens to their O2 saturation when they take a walk. We want it. So we're able to really put a lot more thought behind and input into what are these patients needing so that we can keep them as healthy as possible, reducing those readmissions, obviously heading off anything early so that if we do see in the portal, for example, we go in the morning and we see, okay, since yesterday, that respiratory rate has increased. Since yesterday, the chest x-ray has changed. So now we're able to really manage that patient without them having to be readmitted a lot of times.
Right. Yeah. It provides that second set of eyes and ears. You know, a lot of skilled nursing facilities are very much short-staffed these days. That's, you know, that's across healthcare and hospitals, but especially at the skilled nursing facility, we're seeing, you know, within the space, we're seeing a lot of turnover in staff. And so, you know, the nurse or the DON who have been seeing the patients may have a turnover and they may not know much about the patient, whether it's what they're seeing is a baseline presentation or if it's something that they need to take action on. So having someone that has a longitudinal view of the patient, you know, and may have interactions or know what their baseline is from their primary care physician is really valuable in helping treat those members and patients in place.
It really is. And also, I mean, we're able to then communicate with the patient's family. We're able to say, hey, this is what we're seeing. What are you seeing? And sometimes we'll call the patient and we'll get a little bit different picture. So actually the patient is up, they're moving around, they're doing better today. Nobody's been in to see us yet because, like you said, we are seeing a lot of staffing shortages. So we are able to then supplement that with those additional lab orders, with those additional radiology orders, with any increase in frequency of vitals to be measured. So anything that we feel might be helpful, we're able to put that other set of eyes on that patient. Exactly what you said. Yeah. And it's invaluable. You call the health plan and you say, hey, this is what we're seeing, and we don't feel like our patient needs to necessarily be there anymore. We're trying to get a hold of the SNFist and really keeping the health plans in the loop, which obviously does not work well when you're dealing with CMS, but that's not really an option. But as you're dealing with your Medicare Advantage patients, that is a bonus as well.
Yeah, absolutely. In terms of managing that length of stay, or even we've seen a lot of, you know, ACOs who have, you know, really gotten a lot of success in decreasing the length of stay because they're being made aware. They see what the discharge barriers are. You know, if the patient lives in a remote community that they can't find a home health agency to come see them, that's where you and the payers can come in and say, we can help, and we can help the skilled nursing facilities find a proper discharge disposition for this patient.
Yeah, absolutely. I mean, it's really changed the game. I mean, being able to have that much say and input and real-time view of what's going on with your patient it's really helped. And as we do see these decreases in staffing ratios, this is how we can, without having to put somebody physically in every single SNF, we're still able to influence that patient care, influence that length of stay, and prevent those readmissions to inpatient.
In fact, what successes have you seen so far from your strategy and from the team that you've put together?
Right. So I would say at this point, we're still a little bit early in the game to be able to put hard numbers with it. But I will say, holistically, our biggest financial win is being able to impact that length of stay.
Mhm.
Our biggest patient experience win is now we are able to communicate with that patient, communicate with the patient's family, really let them know, hey, we are in contact with the provider that's seeing you. We are on top of this, which really speaks volumes to those patients. We know our providers, our primary care providers, they're in the office with patients sometimes 10 hours a day or more. They don't have time to go and physically see every patient, but we're able to be that voice. So really improving that patient experience has been something that we have seen that we didn't expect to necessarily see. We knew, yes, we're going to try to influence length of stay. We're going to try to influence readmission to the hospital, but we didn't realize the impact it would have on patient satisfaction.
I love that. And I think that brings to the forefront the theme of like that I hear at every FLAACOs or every NACOs conference is that patient engagement.
Mhm.
How do we have our members or beneficiaries see, one, let alone know that they're part of an ACO, but secondly, what are the benefits of having an ACO, of being part of an ACO, and having that, like you said, that longitudinal view of the patient, regardless of what encounter they're having.
Absolutely. I mean, we like I said, we did not expect to see that, but it was a pleasant surprise.
That's great. I see a raised hand. Kim, I think I will unmute you if you have a question.
Yes, hi, thank you for this discussion. Andrea, I just wanted to better understand, you have 8 RNs that virtually oversee how many patients in the SNF?
So of course, our patient census changes. You would be surprised how much it can change in 24 hours. But yeah, so our total patient population is about 250,000 across all of our lines of business. Obviously, they're not all in SNF, and we do not have this SNF available, this SNFist team and the nurses available in every state. So I would say the coverage that we have is probably approximately 100,000 patients. And those 8 nurses are handling the SNFs for those 100,000 patients. The SNF is
Understood. And are they like living in packs? Is that where they're getting the information from, and then they drive conversations telephonically?
Yes. So everything that we handle is on this team is telephonic. We do have providers that go in person to different settings, but for our SNF, we only handle that telephonically.
So I guess this is, how has the experience been with the telephonic nurses engaging with the in-house therapists and in discussing length of stay? Because they are virtual, they're not in-house, there's a relationship building,
Right.
the impact that may have with the primary care physician who's overseeing. Are they aware that you're involved? So how, could you give me a better idea or color as to how that looks?
Sure. So we do have JOCs with our SNFs that we work with the most. We do those virtually as well. So we are working with the SNF as an umbrella organization with that SNF. And then we also are every single day, we have the SNFs that our patients go to most. We are constantly in contact with either the nursing staff that's there overseeing or the SNFist that's on staff there that's in the SNF that day. So we have not had any issues. Well, I won't say we haven't had any issues. We haven't had very many issues with any pushback. A lot of times they appreciate that somebody else is taking an interest and keeping an eye on these patients and able to say, hey, have you noticed this? And did you see this lab value drop? Or what are we doing with their physical therapy? Are we getting them up this many times a day? I just talked to the family, not sure who's been in there. So it definitely does take a special personality to be able to do this. And we do a lot of training for sensitive discussions and how to approach things. We have a lot of training modules for our staff about how do you talk to these people virtually, because they don't see your face. And if they're not seeing your face, then they can take what you say in a lot of different ways. And I think that's been the biggest lesson learned, was those trainings on how do we have those discussions. We wished we had done that earlier.
Okay, that's great to know. Thank you.
Sure.
Yeah, I think to touch on that too, Andrea, right? Like, for folks, they may start off with having those discussions with their acute care counterparts, whether it's those discharge planners in the hospitals or even case managers for those in partner hospitals. It's a similar approach wherein, like, you're not necessarily there to like take over, right, like their clinical decision making, but to offer your support in another set of eyes. So I'd approach in that. Certainly, I probably wouldn't go guns a-blazing and say, hey, this is me, we're gonna take over, but like really developing those relationships with the SNFs, and they also have a skin in the game here, because you all are referring partners to them. That's also referring your members to their skilled nursing facilities. So I think there's a symbiotic relationship there.
Yeah, absolutely. We worked really well with those partners, but and as I said at the beginning, there were some ruffled feathers. There were some, I own this patient, this is my patient. I want to tell you how to manage them, and you really have to manage personalities as well. We can do the clinical. Obviously, the clinical is what we do well. So then the interpersonal relationship training and the how do we have those discussion training is important. It's important. But I do think that there is, at this point, we have a very good relationship with our partners. We very rarely have anybody come back to us and say, well, how dare you tell me how to treat this patient? I'm here with them in person. A lot of times what we're actually seeing is, oh yeah, thank you for bringing that to my attention, or we didn't even see that. We haven't been able to get in to see the patient yet. I'm still over at this SNF. I haven't made it to that one yet. So it gives a heads up of, hey, when you get over there, can you take a look at this?
Well, Andrea, I really just want to thank you for your time today. I think this is a very good.
Thanks for having me.
Fruitful discussion. We're excited to be partners with you all, and kind of looking forward to your continued success.
Yeah, thank you so much. And we do love the platform. So
great.
We're looking forward to more SNFs coming on board in other states.
Absolutely. Yeah. Speaking of which, that's what I'm going to be showing next. I'll be showing you the platform, what we're calling PACMED, or post-acute care network management, that Andrea and her team are using to give them visibility of what's happening with their patients and members at the skilled facility, so that they can intervene. So let me go ahead and share my screen. I'll go up as well. So this is our post-acute care network management solution. I'm going to call it PACMED for short, so it's not a mouthful. Really, all the data that comes in here is coming directly from that EHR at the skilled nursing facility. It starts off during implementation is that we would be taking in your patient panel or roster of your membership, so that we can identify which patients, residents, or members you have that relationship with, so that we can let you know where they may be at any given point. So well, I'll orient you to two pieces here. First, the patient monitoring page, and then the network scorecard. In the networks, in the patient monitoring page, this really shows you all of your patients that are having an active stay at a skilled nursing facility stay. So it lists all of those patients out. So again, this prevents you from having to manage different lists that may be faxed to you or emailed to you from different facilities. With just one single pane of glass, you're able to see all of your patients, including their name, their location, what their primary diagnosis is, their length of stay at the SNF, their hospital readmission risk, which I'll talk more about shortly, their admission date, and where they were admitted from. So this gives you all of those patients, but you could also hone in on specific types of patient populations based on the filter, so that you can this can follow the structure of your team. So for instance, if you have, Andrea mentioned that she has 8 nurses that's following these patients. If those 8 nurses are assigned to specific skilled nursing facility, nurse A can then just filter to specific skilled nursing facilities and hone in on those specific patients. So they don't have to really dig to find the information or having to sort through multiple patient lists to find their patients that they're managing. You also can filter the list below based on stay type, whether it's skilled or custodial, based on diagnosis group. So think about if you're managing orthopedic patients, you can choose a diagnosis, whether it's a post-op hip or knee. You can filter based on that. You can also filter based on discharging hospital, based on a specific identifier that you provide to us, or based on payer type or the payer if you're managing multiple different lines of businesses. Now, I can also filter the list below. So really, as you can imagine, we can scale your operations, because then you won't need as much staff to manage the patient if you can hone in specifically, for instance, on those patients who have the highest hospital readmission risk. Knowing and filtering based on this patient population, I can then make sure that I can prioritize my time on those patients that are needing my support or my extra pair of eyes. I can also filter based on minimum length of stay. So if your target length of stay within your organization is, let's say, 25 days, I can filter based on that and see these 2 patients have at least 25 days, so I can see if what the discharge barriers may be that's contributing to that long length of stay. But before I even pick up the phone to call the skilled nursing facility and ask how is my patient doing, it looks like they're high readmission risk or they've been there for a while, I can click on the patient's name, and that takes me to a chart level overview of what's happening with the patient. In this view of the patient, I can have I'll be able to see an overview page that shows me, and this is taking a while, so let me refresh here. On that page where I can see the patient's chart level data, I can see an overview, which then shows me the patient's attending physician or provider, and I could be able to see their code status as well, their latest vital signs, and their active medications. In this view, you would also be able to see their diagnoses, their vital signs as it's trending. So I would think about it, even if you're not, for instance, following patients during their skilled nursing facility stay, think about how useful this data would be should you be following this patient after in your physician's office, after they've been discharged from the skilled nursing facility, you'd be able to get not only, because it's just one data point, if you get their last daily weight, think about patients who have congestive heart failure, but their trend, for instance, for their weight over time. I would be able to also see here their lab results. So think about patients who have any labs that they need to get drawn, whether it's their coumadin levels or their hemoglobin A1C. Those could also be viewed here as they're taken from the skilled nursing facility. Radiology, orders, including their medication list, and then probably the biggest reaction that we usually get from folks are from being able to see therapy notes as they're documented at the skilled nursing facility, so you can help prepare for the discharge of this patient to the next level of care. So if this patient needs a caregiver at home, an assist, or a DME or an oxygen tank when they go home, you'd be able to see that and anticipate it. Again, Andrea nailed it in the head. From a patient experience perspective, you don't even have to call the patient and ask, okay, tell me what happened at the skilled nursing facility, tell me what needs you have at home. You're able to anticipate that even before discharge and while the patient is still at the skilled nursing facility. Now, moving from the patient monitoring page, you'd also have the network scorecard. The network scorecard compiles real-time data to show you key performance indicators specifically for your patient population, including at the skilled nursing facility, including the 30-day readmission rate and average length of stay. I have the same filtering mechanism that I have from the patient overview page. So if I want to focus in on a specific diagnosis group, I can filter based on that, or filter based on one or a group of skilled nursing facilities to be able to see those results. Change based on those filters. What's great about this is that you can also see a stacked view below, so you'd be able to compare the results specifically for your patient population at different facilities, so you can see, for instance, where your patients are being referred to or going to the most. So in this case, I'm seeing in the last 90 days, most of my members have been going to Madeline Skilled Nursing Facility, and I have a 30-day readmission rate of 75%, average length of stay of 15.7. When we look at last year here, because it probably has more data, then I can then know which facilities I need to focus in on, or may need more of my support. I can also look at the stacked view here based on diagnosis groups. So this is helpful in terms of looking at specific diagnoses that I need to focus my attention on, and maybe I need to develop more treatment or clinical pathways around. So if I'm seeing that most of my readmissions are occurring for my CHF population, I need to make sure that I talk to my skilled nursing facilities about taking daily weights, looking at diet, about adding additional salt, or maybe it's like, looking at what support they may need in terms of, do they even have enough scales? Like we've seen like an ACO just gift a skilled nursing facility a set of standing scales because they don't have enough. Their staff have been complaining because, like, we can't do the daily weights in time because we have to lug him around from room to room to room. So key things that can help you in terms of planning for root cause analysis for what may be driving this 30-day readmission and average length of stay. So again, that takes you to a higher level overview of what the solution can do for you. There's a lot more happening here that we could show you, but given the lack of time, I'll leave it at that high level overview. so that we can have some time for question and answers. And I know I'm already seeing some questions pop up, so I want to address them. So I'm going to stop sharing, turn on my my video, and look at some of the questions that you all have posed on the question and answer. And if you have any other questions, feel free to add them on or raise your hand. So I'm seeing here, could you provide more insight and examples of ACOs embedding staff into the skilled nursing facilities? How are they received and how staff responds to their suggestions? So it all depends on that relationship, as we were talking about, that you already have with a skilled nursing facility. That embedding staff into the skilled nursing facility isn't usually the first step that ACOs take. It's building that relationship first. And a lot of times having that preferred skilled nursing facility network, or most people these days call them like a high performance network. You know, a lot of times skilled nursing facilities want to be part of your network. So, you know, that could be part of your arrangement, that in order for you to be part of our preferred group, you could allow us to embed staff into the SNFs. So those are typically some of the arrangements that different ACOs or skilled nursing facilities have with different as different arrangements. They're typically received in varied ways. I think over time, though, depending on how well you develop those relationships, those embedding those staff are seen very positively. So think about, we've seen ACOs have a clinical pharmacist, for instance, that would help in terms of med rec at the skilled nursing facilities, so that they don't miss any medications that the patient may need to be on. So think about patients who may have some medications that they're taking at home, or maintenance medications that they're taking at home, stopped or discontinued while they're in the hospital. When they're transferred to the skilled nursing facility, those patients, you know, they may forget to restart those medications. So in ACO, having an embedded clinical pharmacist may prevent those things from happening. Next question we saw, I think we've answered, Andrea helped answer that in terms of staffing for 8 RNs per patient population. Question from Denisha: who at the SNF manages the information to input for us to view? So at the skilled nursing facility, it's not something that they have to do in addition to their regular workload. That's the beauty of the solution, because we are the EHR at the skilled nursing facility. They don't have to do double documentation from their EHR to another platform to show for you all to get this information. So that's to say that this is all coming from the documentation that they typically already do, that they input in their EHR. What happens during implementation at this is that we have those skilled nursing facilities sign a data sharing agreement saying that organizations who have a TPO relationship with the residents or patients that are staying at their skilled nursing facilities would be able to view this information for clinical purposes. So they grant us permission to share it to folks like yourselves who are managing different patient populations. The next question is, what is the SNF incentive to ensure information is up to date? So in terms of ensuring the information is up to date, you're totally correct, right? Same thing with hospital documentation, same thing with skilled nursing facility documentation. It all depends on the staff to make sure that the information is up to date. The incentive for the SNFs to keep information up to date are key regulations that they have to follow in terms of already outside of having to share this information, right? Making sure their ducks in a row should there be someone that's coming in to do a survey for them to make sure that their information is up to date. And that's to say that you can also, that this gives you a set of eyes, right? If the patient is supposed to have an order for daily weights in the morning and you're not seeing that, that's something that you can follow up on them on. The incentive there is that because like that's what's been ordered, and from a relationship building perspective, the incentive is that these skilled nursing facilities also want to provide high quality care for their patients. They want to maintain their 4-star ratings, or even, or move from a 3-star rating to a 4-star rating. So having up-to-date information is included in getting those quality ratings and their reputation up in the community. Very good. And then, so to Venetia's point, so we literally have access to their EMR. Venetia, that is correct, but you don't have access to their whole EHR, meaning you don't have access to all of the residents or patients at their facility, because we don't want to break HIPAA. You don't want to break HIPAA. They don't want to break HIPAA. You all provide us with a list of who you have, of which patients you have a relationship with. We once the patient hits the skilled nursing facility, we show you a view of their EHR of those key things that I showed you earlier, those clinical things. You won't have a view of their billing status or anything like that. But yes, to your point, you have a view of their EHR in real time for those specific clinical elements that we found are needed for ACOs to help manage those patients at the skilled nursing facility. Let me see, I think that was one of the last questions here. Feel free to send them in. Let me look at the chat if there are any other questions. I think those are the questions. Feel free to go off mute or raise your hand should you have any other questions. But I'm gonna sort of also, what I'm gonna do is I'm gonna put up, should you be interested in continuing this conversation, learning more about what we're able to do, because I just showed you a small tidbit of what our post-acute care network management solution is able to do. I will put up on the screen our team's information so that you can reach out to us. We can schedule a full demo, and then consider us as well as your partners in terms of what we're seeing in the skilled nursing facility markets. If you're looking for any support in terms of developing your post-acute care strategies or even your transitions of care strategies, let us know. Happy to help out in any way. What's great about working across the country is that we're able to hear about the different tactics and strategies other ACOs are doing, and we're happy to share those best practices to other organizations as well. With that, Samantha, Sam, Julia, Will, any other thoughts, parting questions, any dad jokes that you want to share?
This was great, Jose. We truly appreciate you hopping on here and presenting this. I know, truthfully speaking, a lot of great questions were asked, and from a FLAACO standpoint, we don't get this many questions. So you definitely hit on a hot topic. I think that our members really are engaged with. So thank you for taking the time to show this today.
You're so welcome. I see a question. Are we able to extract clinical data? So there are specific data sets that you're able to extract. So for instance, you can get a PDF, download a PDF copy to perhaps send to your physician, the patient's provider. Labs, and I'm thinking top of my head right now, labs you can extract, the therapy notes you can extract as a PDF. I think those are the ones that are on top of my head, and I think the face sheet, or what I call the face sheet, but the overview page. Kim, let's have you go off mute.
Are you able, another file on PCC that's quite active is miscellaneous or documents. They usually upload hospital records. Even though the HIE is quite active, sometimes it's not always complete. Is that data that you can also pull over to us? Do we have access to that?
Yeah, that's a possibility. It depends on if that is something that the skilled nursing facility has agreed to share across the network. Typically, they have a list, and sometimes it's, as you probably know, they can be a bit unstructured in terms of the way that they use different note types. So it's like miscellaneous is sort of a catch-all they take on. It could be like a progress note, is a type of note, a nursing progress note. So it depends on what type of notes they're sharing, but that could be one of the key things that we could take a deeper dive. One of the first questions that we ask with ACOs that we partner with is like, tell us where your patients go to, or which skilled nursing facilities are in your network, and then we can do an analysis of those skilled nursing facilities to see who's in our network, who's not, and then what sort of data, particularly on the note section, they're sharing, so that you can we can give you a good understanding of the value that you're getting from the solution.
Great, thank you.
Yep, you're welcome. And what other format the clinical data is available other than the PDF document? That's the current state right now, Kim. In the future, we're looking to see what we're able to automate, but for now, it's under the PDF document. Very good. Well, thank you so much for being so engaged, for the conversations. Thank you for asking really great questions. Again, our information is on shared right now on your screens. Jot it down and then let us know should you have any questions in the future. We'd be happy to continue the conversations with you. All right, very good. Well, thank you so much and have a great day.
Thanks, Jose. Take care. Thank you, everyone.